Hello everyone, I am Dr. Mansi Gupta, Consultant Fetal Medicine at Cloudnine Hospitals, Lucknow. Amniocentesis is a prenatal test which you might be offered during pregnancy when there is a doubt that your baby might have some genetic problem or a chromosomal problem or infection that might have been inherited to the baby. During the process of amniocentesis, a thin needle will be passed from the mother's abdomen into the womb and outside the baby. There is a good amount of fluid which we call as liquor that surrounds the baby. A few milliliters of that fluid will be sampled out and will be sent for analysis. In case the result comes out to be positive, it means that the baby does have the condition that we had a suspicion of. In that case, you need to meet the specialist for that condition who can guide you on what can be the implications, what can your baby have symptoms after birth, how will be the life of the baby after birth. After this discussion and discussing with your close family, you can take a call and decide the further course of your pregnancy.